The operating room went quiet before the first incision was even made. Outside Greystone Medical Center, 3 armored military vehicles rolled to a stop on the wet asphalt, engines idling. Nobody moved. A scrub nurse dropped a tray. The clatter echoed through the corridor like a gunshot. Then the doors opened. 8 Special Forces operators moved through the hospital entrance in full tactical gear, and they weren't asking for directions. They weren't heading toward the chief surgeon. They weren't stopping at the administrative desk. They walked straight to the night nurse standing in the hallway with a mop bucket and a paper cup of cold coffee. The woman everyone had spent months pretending wasn't there. If this story already has you holding your breath, you're exactly where I want you. Stay until the end. Drop a comment telling me what city you're watching from. I want to see how far this story travels. And if it moves you, hit like and follow so you never miss what comes next. The first time Emily Dawson heard the word incompetent directed at her, she was standing in the break room at 2:47 in the morning, refolding a supply cart that someone else had left in chaos. She heard it through the wall, Dr. Marcus Veld's voice, carrying the particular confidence of a man who'd never once doubted himself in 43 years of living. Incompetent. I don't know how else to describe it. She questioned my post-op protocol in front of the resident. In front of the resident, a lower voice responded. Probably Dr. Sasha Oren, his second, who laughed at everything Veld said because she was still 2 years from her attending position and couldn't afford not to. She's a night nurse, Marcus. What do you expect? Emily finished folding the cart. She picked up her coffee. She went back to work. That was 3 months ago. Since then, she'd learned to pick her moments more carefully. She'd learned which battles were worth the cost and which ones would just get her written up again. She'd learned that Greystone Medical Center ran on a very specific hierarchy, one that placed Dr. Marcus Veld at the top, a rotating cast of ambitious attendings just below him, and the night nursing staff somewhere around the level of furniture. She hadn't always worked nights. She hadn't always been invisible. But Emily Dawson was good at adapting. The Army had taught her that. She was 29 years old, 5'6", with the kind of posture that people noticed without knowing why. Shoulders set, chin level, nothing wasted in how she moved. She kept her dark hair pulled back in a knot so tight it gave her a slight headache by 4 a.m., and she wore her ID badge clipped to the left side of her scrub top because that was regulation, and she still followed regulation out of a habit she'd never quite shaken. She'd been working the overnight shift at Greystone for 14 months. Before that, she'd spent 6 years doing things that her employment file didn't mention. The Army service was on her resume, vague and brief. Medical support, honorable discharge. No one had ever asked her to elaborate. People saw the nursing credentials and stopped reading. This suited her fine. Greystone Medical Center occupied a converted industrial block on the east side of Black Ridge, a mid-sized city in the Pacific Northwest that hadn't fully decided if it was urban or tired. The hospital was 11 floors of glass and poured concrete, perpetually under renovation on the upper floors and perpetually underfunded on the lower ones. It had a Level 2 trauma designation that the administration mentioned in every press release and a nursing turnover rate that they didn't. The night shift ran lean, always had. Emily's supervisor was a woman named Patrice Hollis, charge nurse, late 40s, with reading glasses that lived permanently on top of her head. Patrice was not unkind, but she operated under the same survival logic as everyone else at Greystone. Keep your head down, don't antagonize the surgeons, and log your hours correctly so administration had no reason to look at you. She'd told Emily early on, "You're sharp, too sharp for nights, but you push too hard and you're going to make enemies you can't afford." Emily had nodded and said she'd keep it in mind. She hadn't kept it in mind. On the night of the 14th of November, Emily was 40 minutes into a double shift, her second in 4 days because Greystone was chronically short-staffed and she needed the hours, when the first unusual thing happened. The trauma bay received a call at 10:22 p.m. She wasn't supposed to hear it. She was in the medication room 2 corridors over, pulling a 2 a.m. insulin draw for a patient in 4 East. But the trauma bay doors were open, and the voice on the receiving end of the radio was Dr. Veld's, and Marcus Veld had never once modulated his volume in his life. How critical? A pause. Classified? What does that mean, classified? This is a hospital, not a... Another pause, longer. His voice changed slightly. Yes, Yes, I understand. Prepare OR2. Emily finished the draw. She capped the needle. She set the tray aside. Classified. She knew what that word meant in a context like this. She'd heard it used in field conditions before, in situations where the word wasn't bureaucratic caution, but something with actual weight behind it. She filed it in the Baypack of her mind and went back to 4 East. The next 2 hours were ordinary. Post-op checks, a confused patient in 6 West who kept removing his pulse ox, a medication reconciliation that someone had flagged incorrectly. Emily moved through the work with the focused economy of someone who'd learned to function on 4 hours of sleep in environments considerably more hostile than a short-staffed hospital corridor. At 12:15 a.m., she heard the helicopter. Greystone's rooftop pad was directly above the 8th floor. When a bird came in heavy, when the descent was fast, when the weight shifted, you could feel a faint vibration in the walls if you were standing in the right place. Emily was standing at the nurse's station on 6 when she felt it. She looked up at the ceiling for exactly 1 second, the way you'd check the sky for weather. Then the elevator lights started moving. 8, 7, 6. The doors opened and a gurney came out at a controlled run, flanked by 2 people in civilian tactical clothing. Not paramedics, not air transport staff. One was a woman with close-cropped gray hair who moved like she'd run through hospitals before. The other was a man with a radio at his collar who was already scanning the corridor before the doors finished opening. On the gurney was a man in his early 60s, eyes closed, a field dressing on his left shoulder that had been applied with professional precision. His color was poor. His breathing was shallow but deliberate, the kind of breathing you used when you were conscious enough to try to manage your own airway. There were 2 IV lines already running. His blood pressure reading on the portable monitor read 88/52. That was low. That was bad. Emily stepped back to let them pass. The gray-haired woman didn't look at her. The man with the radio did, briefly, evaluating, then dismissed. She went back to her chart. But she kept thinking about that blood pressure. Dr. Veld arrived in surgical prep at 12:31 a.m. in the particular way he always arrived, already annoyed at whatever had summoned him, already composing his displeasure into something that sounded like authority. He had a chief resident with him, a young man named Dr. Paul Hearn, who was technically competent and thoroughly terrified of Veld in the specific way that made him worse at his job. The operating suite briefing was, by all accounts, Emily could piece together from corridor conversation, unusual. The patient's identity was not being shared with standard hospital staff. The paperwork was being processed through a separate administrative channel. A man in a dark blazer whom nobody had introduced had been in the OR administrator's office since 11 o'clock. Emily heard most of this from Donna, a scrub tech with 20 years at Greystone who knew everything that happened in this building and shared it freely with people she trusted. "Veld's not happy," Donna said, appearing at Emily's elbow with a styrofoam cup. "Says he doesn't like operating without a complete patient history." He's not wrong about that. He's also complaining about the equipment check. Says the backup monitor in OR2 was flagged last week and nobody replaced the relay. Donna shook her head. "That's been on the maintenance list since October." Emily set down her pen. "The backup monitor for what?" "Cardiac. The primary's fine, but if they need to switch over..." "Has anybody told Veld which unit they're running the secondary arterial line through?" Donna looked at her. "I don't know. Why?" Emily was already moving. She didn't go to Veld. She'd learned that much. Going directly to Veld with a concern was like handing him a reason to dismiss you, because he'd spend the first 30 seconds deciding whether the interruption was worth his time, and then the next 30 seconds explaining why it wasn't. She went to the OR charge, a quiet, careful man named Ray Tsu, who had been coordinating surgical logistics at Greystone for 11 years, and who took equipment concerns seriously because he'd once watched a faulty monitor contribute to a complication that ended a patient's life, and he'd never stopped thinking about it. "Ray?" She caught him in the equipment corridor. "The backup cardiac monitor in OR2, is it cleared for tonight?" He checked his tablet, then he checked it again. "It was signed off by maintenance last Thursday." "Donna says the relay was flagged in October. Has anyone run a full load test on it since the sign-off?" Ray's expression shifted. Not alarm, but the specific attention of someone who takes a question seriously. "I'll check." The patient they're prepping has a pressure of 88/52. If they need to switch to secondary during, I'll check right now." He was already walking. Emily went back to her floor. At 1:40 a.m., the PA system paged a supervisor to the OR corridor. Not an emergency page, an administrative one. She noted it and kept moving. At 1:55 a.m., Patrice Hollis appeared at the nursing station with an expression Emily had seen before. The expression of someone delivering a message they hadn't written and didn't agree with. "Emily, can I talk to you for a second?" She followed Patrice to the end of the corridor, out of earshot of the other staff. "I got a call from Dr. Veld's office," Patrice said. She didn't look at her directly. "He's requesting that you be pulled from the surgical floor for the remainder of the shift." Emily waited. "He's saying you went around him on an equipment concern, that you interfered with pre-op logistics. I talked to Ray Tsu about a monitor relay." "I know. The backup cardiac unit in OR2 hasn't been load tested since a flagged service call in October. That patient is presenting with significant hemodynamic instability. If there's an intraoperative—" "Emily," Patrice finally looked at her. "I know, okay? I know you're probably right, but Veld is threatening to file a formal complaint, and the administrator on duty tonight is backing him. If you push this, they're going to write you up for insubordination, and that's going to go in your file." "There's a patient in that OR." "I know there is." Patrice's voice was quiet and strained. "And I also know that if you lose your license over this, you can't help any patients." Emily looked at the wall for a moment. The fluorescent light above them buzzed, a small, persistent sound she'd been meaning to report for 2 weeks. "Where do you need me?" she said. "Supply check on 4. "I'm sorry, Emily." She nodded. She picked up her clipboard. She walked toward the elevator. He said, the supply room on the 4th floor was where they stored overflow from Central, extra IV bags, packaging for disposable equipment, a rack of backup gowns. It smelled like plastic wrap and the particular antiseptic that Greystone used in their biohazard bags. It was a room that nobody came to unless they needed something, which meant it was quiet, which meant there was nothing to do except work and think. Emily worked, and she thought. She thought about the patient's blood pressure. She thought about the way the 2 civilians in tactical clothing had moved, not like hospital staff, not like standard transport, but with the practiced situational awareness of people who operated in environments where your surroundings could become hostile without warning. She thought about the man in the blazer in the administrator's office. She thought about the word classified. She was on her 3rd inventory count of the IV bags. She'd lost her place twice, which wasn't like her, when she heard footsteps in the corridor outside. Not the usual hospital gait, the slightly shuffled movement of people who'd been on their feet for 8 hours. These were even, deliberate, the heel-to-toe of someone moving with purpose. More than one set. Emily set down her clipboard. She crossed to the door and opened it. The corridor was empty. She stepped out and looked both ways. The hall curved slightly toward the east stairwell, and as she looked, she caught the tail end of something. A shadow, the edge of a figure disappearing around the bend. Dark clothing, not scrubs. She stood there for a moment, alone in the corridor with the buzzing quiet of a hospital at 2 a.m. Then she went to the stairwell and listened. Footsteps. Moving down. Toward the lower floors. She thought about the equipment room. The one that serviced the surgical suites. She thought about the monitor relay. She should go back to the supply room. She should finish the inventory and keep her head down and let Veld run his OR and hope that the backup cardiac unit didn't fail during an operation on a classified patient with a blood pressure of 88/52. She should do what Patrice had asked her to do because Patrice was trying to protect her and because Emily was 14 months into a life she was still building and she had learned, in the army, in the field, in the specific grief of watching things go wrong that didn't have to, that sometimes you couldn't stop what was coming. She took the stairs. The equipment service corridor for the surgical suites was on the 2nd floor, behind a keypad access door that required either a maintenance badge or the override code that was printed on a laminated card taped to the wall next to it, because Greystone's security was, in practice, mostly theoretical. The door was ajar. Emily pushed it open with 2 fingers. The room was dim, maintenance lighting only, the low red amber of systems at rest. Banks of hardware lined the walls, monitoring relays and backup power units, and the unglamorous guts of what kept the surgical suites running when the primary systems were under load. She knew this room. She'd been here twice before. Once during orientation, once when she'd followed up on a reported fault herself and found that the reported fault had been closed without anyone actually looking at it. She moved along the relay bank to the cardiac backup for OR2. Someone had been here recently. The panel cover was slightly off-center, not open, not obviously tampered with, but off by 2 millimeters from its housing. The kind of thing you'd only notice if you were looking for it, or if you had the habit of noticing things that were almost right. She pulled a small pen light from her pocket. She checked the relay housing. Then she checked the connection behind it. One of the secondary contact pins had been partially retracted. Not broken, not visibly damaged, just repositioned in the specific way that would cause the unit to appear functional during a standard check while failing under actual cardiac load. The kind of load you'd see if a patient's primary line went down during surgery. Emily stood in the dim equipment room with her pen light in her hand and understood what she was looking at. This wasn't a maintenance failure. Someone had done this deliberately. She was reaching for her phone when she heard the door open behind her. "Step away from the panel." The voice belonged to a man in his 30s, heavy-set, in the dark civilian clothing she'd seen earlier. Not the man with the radio, a different one. He was standing in the doorway with the particular stillness of someone who knew how to make a room feel smaller. Emily didn't move. "I said step away." "I'm a nurse on staff at this hospital," she said. Her voice was level. "The backup cardiac relay for OR2 has been manually compromised. The patient currently in pre-op is going to crash if someone doesn't. That's not your concern. Step away from the panel or I will physically remove you." She looked at him for a long moment. He wasn't hospital security. His body language was wrong for that. Too coiled, too ready, with the particular quality of someone who was used to situations that escalated. He wasn't law enforcement either. Whatever he was here for the same reason the man in the blazer was upstairs. And whatever reason that was, it didn't include the survival of the patient in OR2. "You're going to have to remove me," she said. He took a step forward. The stairwell door at the end of the corridor opened. What came through it was not what either of them expected. 4 men in tactical gear, full kit, body armor, earpieces, weapons holstered but present, moving fast and quiet. They cleared the corridor in under 3 seconds, and the heavy-set man in the dark clothing had exactly enough time to register what was happening before 2 of them had him by the arms and his options were gone. The 5th person through the door was a woman, tall, early 50s, silver hair cut military short, wearing a jacket with no insignia. She moved like the room belonged to her, which Emily was starting to understand it probably did. She walked directly to Emily. "Sergeant Dawson," she said. Not a question. Emily's penlight was still in her hand. She hadn't moved. "I haven't been a sergeant in 3 years," Emily said. "No," the woman agreed. "You haven't." She looked at the relay panel, then back at Emily. "Show me what you found." Yes. Her name, Emily would learn, was Major Carrie Thorne. Retired, but that word sat loosely on her, the way it does on people who were never really done. She'd been with the Intelligence Support Unit attached to the 3rd Special Forces Group for 11 years before medical retirement, and she'd been in Blackridge for 72 hours coordinating the secure transport of a man named Raymond Voss. Commander Raymond Voss. Decorated. Intelligence Division, currently bleeding internally in pre-op on the 6th floor of Greystone Medical Center because someone had tried to kill him twice in the last 4 days and had partially succeeded the second time. He was also, Emily gathered from the compressed version Thorne gave her while they stood in the equipment corridor, about to testify before a federal committee on something that several people with significant resources would prefer he never testified about. The attack that had put him in that helicopter hadn't been random. The delay in his transport, the selection of Greystone over the regional trauma center with a level 1 designation, none of that had been random either. "Someone moved his transport to this facility," Thorne said. "Someone who knew that Greystone's administrator has been on a particular payroll for 14 months. Emily thought about the man in the blazer in the administrator's office. "Administrator Decker," she said. Thorne looked at her sharply. What do you know about Decker? I know he's been on duty tonight when he's not scheduled. I know he backed Veld's decision to pull me from the floor after I flagged the equipment issue. She paused. I know that the maintenance sign-off on this relay is dated Thursday, and somebody was in here after that. Thorne was quiet for a moment. Behind her, the man who told Emily to step away from the panel was being walked toward the stairwell by two of the operators, his hands zip-tied, his expression somewhere between furious and calculating. The surgical team doesn't know the relay's compromised, Emily said. Veld's running on primary line, but Voss's pressure is low enough that there's a real chance they'll need the backup during. Can you fix it? Emily looked at the panel. She'd been a combat medic for 6 years. She'd worked in field hospitals where fix-it meant improvising with what was physically in front of you because the alternative was watching someone die. She'd worked in conditions where the equipment was worse than this, the stakes were higher than this, and the margin for error was 0. I need 10 minutes and the cover off, she said. You have 7, Thorne said. They're pushing pre-op. She fixed it in 6. She wasn't smooth about it. She stripped a knuckle on the second contact pin and had to reposition her grip, and her hands were shaking slightly by the end. Not from fear, exactly, but from the particular adrenaline of a task where being wrong meant someone died on a table upstairs while you were in the basement being right. But the pin seated correctly, the connection held, and when Thorne's tech ran a quick diagnostic from the handheld unit she'd pulled from her jacket, the relay showed clean. OR2 backup is operational, the tech said. Emily exhaled. She put the panel cover back on, flush this time, the way it was supposed to be, and clicked her pen light off and stood up from the crouch she'd been in for the last 4 minutes. Her knees ached. She'd been on her feet for 11 hours. Thorne was watching her. There was something in her expression that Emily couldn't quite read. Not surprise, exactly, but a kind of recognition. The look of someone confirming something they'd already suspected. We need to talk, Thorne said. The patient. Hearn is competent enough to manage pre-op for another 10 minutes. The primary OR team doesn't know about the relay. As far as they're concerned, everything is nominal, which means we have a window. She gestured toward the stairwell. Walk with me. They walked. Thorne didn't explain herself on the stairs. She moved in silence, two of the operators behind them, until they reached the second-floor landing, and she pushed through into a small conference room that Emily had never been in, mostly because it was used for administrative meetings that nurses weren't invited to. Someone had already set up a laptop and 2 tablets on the table. The screen showed a building schematic, Greystone Medical Center. You've been here 14 months, Thorne said, not sitting. Before that, Fort Duncan. Before that, 2 deployments. Before that, Bragg. Emily stood near the door. You did your homework. I did it 4 days ago when Voss's transport was rerouted to this facility. I wanted to know who was working here. She paused. I didn't expect to find you. I'm a night nurse. You were a combat trauma specialist with the 75th Ranger Support Battalion. You ran field surgery in conditions that would have put half the surgeons in this building face down in the dirt. Thorne's voice wasn't flattering. It was just factual, the way military information usually is. You left after Karis Province. Emily didn't say anything. You don't have to talk about that, Thorne said. I'm not asking you to. She turned to the building schematic. What I am asking is whether you can go back into that building, clear to scrub in, and be in OR2 in 12 minutes. Emily looked at the schematic. OR2 was highlighted. The pre-op corridor was highlighted. The route from the administrator's office to the 3rd floor was highlighted. Veld won't allow it, she said. I was pulled from the floor. Veld's going to have a conversation with the senior operator in the next 4 minutes. And after that conversation, he's going to allow whatever he's asked to allow. There was no satisfaction in Thorne's voice when she said this. It was just another logistical fact. The question is whether you want to be in that room. Emily thought about a lot of things in the space of about 4 seconds. She thought about Karis Province. She thought about 6 years of nights that made 11-hour shifts in a short-staffed hospital look like a vacation. She walked past the nursing station. Patrice looked up, startled, then opened her mouth to say something, and Emily just shook her head once, a small, calm movement that meant not now, and kept walking. She pushed through the OR prep doors. and down the corridor through the observation window of OR2, she could see the surgical team in position, the monitors running, the lights overhead cold and bright and steady. And on the table, not yet under, Raymond Voss turned his head slightly, as if some part of him, the trained, hunted, exhausted part, had sensed that something had changed in the building around him. His eyes opened. He looked at the window. He looked directly at Emily, and she watched the recognition move across his face like a slow tide. A recognition that had nothing to do with this hospital, with this city, with 14 months of night shifts and supply inventories and fluorescent corridors. It was the recognition of a man who had last seen her in a field in Caris province, covered in someone else's blood, keeping 7 soldiers alive with her hands. The surgical intercom crackled. Dr. Veld's voice came through, flat and professional, stripped of its usual edge. OR2 is ready to begin. We have 1 additional scrub joining the team per authorization from a pause, the sound of paper. Per authorization from the senior federal officer on site. Another pause, shorter. Dawson, if you're outside, get in here. She was already moving toward the scrub room. Behind her, in the administrator's office on the 3rd floor, a door opened, and the sound of footsteps that weren't looking for anything anymore, that had already found what they came for, moved into the corridor. The scrub sink was cold. That was the first thing she noticed. The water temperature was off, running cooler than it should, and she spent the full 90 seconds of the surgical scrub with cold water running over her hands and thought, absurdly, that she should report it to maintenance. Old habits. She came through the OR doors at 2:24 a.m. The room smelled like antiseptic and the low electric hum of machinery underload. 5 people were already in position. Veld at the primary station, Hearn across from him, 2 scrub techs, and the circulating nurse, a woman named Jill, who'd been at Greystone for 8 years, and was currently looking at Emily the way people look at someone who just walked out of a wall. There was also a perfusionist standing near the bypass unit at the far side of the room, and he wasn't looking at anyone. "You're late," Veld said without looking up from the instrument tray. Emily moved to her assigned position without responding. Jill handed her a gown without being asked. She was professional enough not to let whatever she was feeling affect the work, which was the only thing that mattered right now. Voss was under. His color was marginally better than it had been on the gurney, which wasn't saying much. The primary arterial line was running clean. The cardiac monitor showed a rhythm that was holding barely, the kind of holding that felt like a conversation you were having with someone who might hang up at any moment. "We're dealing with blunt trauma to the upper left quadrant and a secondary vascular complication behind the 6th rib," Veld said, and his voice had the clipped, deliberate quality of someone who'd decided to be professional about the fact that he resented every element of the current situation. The field dressing delayed some of the internal pressure, but it didn't stop the bleed. "We're going in." Emily cataloged the room. Primary monitor nominal, secondary backup, now fixed, though no one here knew it had been compromised, showing ready. Instrument count looked right. Hearn's hands were steady, which was good. Veld's hands were always steady, whatever else you wanted to say about him. She positioned herself at the secondary assist station and checked the suction line and said nothing. The first 40 minutes were clean. Veld was a good surgeon. She'd known that from her first week at Greystone. She'd heard him talk, which was insufferable, and she'd watched him work, which was something else entirely. In the OR, he became quieter, more economical, and the arrogance compressed into a focused precision that was genuinely impressive. He called his cuts with calm authority, and Hearn responded without fumbling, and the scrub techs moved in rhythm, and for 40 minutes it looked like the operation was going to be difficult but manageable. Then the primary arterial line threw a reading. It wasn't catastrophic. It was a fluctuation, a small, ugly dip in the pressure reading that could mean half a dozen things, some minor, one of them not. Veld called for suction and adjusted his angle, and for 30 seconds the room was very quiet in the specific way that ORs go quiet when everyone is waiting to see if something becomes a problem. It became a problem. "I'm seeing a secondary bleed," Hearn said. His voice was controlled, but his eyes weren't. "Below the primary site. That field dressing shifted something." "I see it." Veld adjusted. "Get me a larger retractor. Now." Emily was already watching the monitor. The primary reading was dipping, holding, dipping. If it dropped another 8 points, they were going to need the secondary line, which meant the backup relay was going to pull active load for the first time tonight. She'd fixed the relay. She knew she'd fixed it. She was 94% sure she'd fixed it. The other 6% was very loud right now. "Pressure's dropping," Jill called out. "I know," Veld said. "Switching to secondary line." The monitor shifted. The backup relay came online. The reading held. Emily breathed. The secondary bleed took Veld 11 minutes to control, and they were 11 minutes that nobody in the room particularly enjoyed. Hearn asked twice for instruments he already had, which Veld noted with a short, cutting comment that didn't help anyone's concentration. One of the scrub techs knocked a clamp and had to be replaced in the instrument count. The perfusionist called a pressure alert and then retracted it 40 seconds later when the reading stabilized. It was messy. It was the kind of surgery that nobody writes up in a case study because it looked nothing like the textbook version and everything like the actual version, which is always worse. But Voss's vitals were moving in the right direction by the time Veld closed the secondary site, and the primary bleed had been controlled 20 minutes in, and the monitor was holding steady on both lines. At 3:31 a.m., Veld stepped back from the table. "We're closing," he said. Emily watched Hearn begin the closure and thought about the relay housing and the retracted contact pin and the man in dark civilian clothing who told her to step away from the panel. She thought about what would have happened if she'd gone back to the supply room like Patrice had asked. She thought about Raymond Voss dying on this table while the people who'd arranged it watched the clock and waited. "Good work," Veld said, to the room generally. It was the closest thing to generosity he'd offered all night. Nobody said anything to Emily directly. She didn't expect them to. But the administrator's office was on the 3rd floor, East Corridor, in a corner suite that had been renovated 2 years ago as part of the hospital's capital improvement initiative, the same initiative that had failed to replace the backup relay in OR2. It had a glass panel beside the door that was supposed to let natural light into the corridor, but mostly let people in the corridor see whether the lights were on inside. The lights were on. Emily was still in her scrub gown, gloves removed, when she came around the corner of the East Corridor and found the 3rd floor looking nothing like a normal hospital floor at 3:45 in the morning. There were 3 federal agents. She could tell by the particular blandness of their clothing and the very specific way they stood in a corridor, like they'd practiced being unremarkable and were now extremely good at it. There was one of Thorne's operators near the stairwell, not doing anything visibly, which meant he was doing something. And there were 2 Blackridge Police Department officers near the elevator, looking like men who'd been called to a situation someone else was managing and weren't sure what to do with their hands. The door to Administrator Decker's office was open. Emily stopped outside it. Wallace Decker was 61 years old, gray-haired, with the kind of face that looked trustworthy because it had practiced looking trustworthy. He'd been the administrative director of Greystone Medical Center for 9 years. He sat at his desk now, with his hands flat on the surface in front of him, not touching anything. And his expression was the expression of a man who had decided that the most important thing was not to say anything at all. Across from him, not sitting, was Major Thorne. She had a tablet in one hand and the look of someone who had already finished this conversation internally and was now just managing its formal conclusion. The man who'd been in the blazer all night was not in the room. Emily noted the absence of him and filed it. "Nurse Dawson." Thorne didn't look up. "Close the door, please." Emily stepped inside and pulled the door shut behind her. Decker's eyes moved to her. A fast assessment, then a calculation, then nothing. He recognized her. She could see it happen in the order it happened. "The equipment corridor was accessed at 11:47 p.m., Thorne said, still looking at the tablet. "We have that on camera. We have the individual who accessed it in federal custody. We have the communications that authorized that access." She set the tablet on Decker's desk, face up. "These are messages from your personal device to a contact we've been tracking for 4 months. They discuss the rerouting of Commander Voss's medical transport to this facility. They discuss the specific nature of the equipment that would be compromised. They discuss the anticipated outcome." Decker looked at the tablet. He looked at his hands. He said nothing. "Mr. Decker," Thorne said, and her voice was completely flat, "you are not going to be able to make a deal tonight. I want to be clear about that because people in your situation sometimes believe that cooperation in the first hour is meaningful. In this particular case, it isn't, because we don't need your cooperation. We have everything we need. She picked up the tablet. The agents outside are going to take you through the service entrance. The night staff have been asked not to use the east corridor for the next 20 minutes. Decker finally looked up. He looked directly at Emily. "You," he said. His voice was low and careful, and there was something in it that wasn't anger, but was adjacent to it. "You were supposed to be in the supply room." Emily looked at him without expression. "I was," she said, "and then I wasn't." That was the entirety of the conversation. She stepped back. 2 federal agents came in and Wallace Decker stood up from his desk with the mechanical compliance of a man whose next several decades had just been decided for him, and they walked him out of his own office and into the east corridor, and that was that. The problem with the end of a crisis is that the floor doesn't stop needing you. Emily spent the next hour doing what she would have done if none of the last 4 hours had happened. Vital checks, medication rounds, the post-op monitoring for Voss that had been transferred to the ICU team, but which she checked anyway because she wanted to see the numbers herself, because she had that specific need to verify with her own eyes what her hands had been part of making possible. His pressure was up. His rhythm was stable. The surgical note said the closure was clean. She stood at the ICU window at 4:55 a.m. and looked at Raymond Voss through the glass, and he was asleep. Sedated, technically, but somewhere beneath that he was asleep in the way that people sleep when the worst thing that was about to happen to them has passed. She went back to her floor. Patrice was at the nurse's station, and she looked up when Emily came around the corner, and there was a whole conversation in the 2 seconds of eye contact. The apology, the relief, the questions Patrice was too professional and too tired to ask right now. And Emily shook her head in the same small way she had hours earlier, and they both went back to work. At 5:40 a.m., Dr. Veld came out of the surgical debrief and walked down the 6th-floor corridor with his hands in his coat pockets and the expression of a man who was actively rearranging something in his head. He stopped when he reached the nurse's station where Emily was charting. He stood there for a moment without saying anything. "The backup relay," he finally said. "Maintenance is saying it was tampered with before the procedure." "Yes." "And you found it?" "Yes." He looked at the counter between them, then at her, then at the counter again. "I was told the authorization to add you to the OR team came from federal law enforcement." "That's correct." "Right." He tapped the counter once with 2 fingers, a short, unreadable gesture. "I didn't know about the relay when I had you pulled from the floor." "I know." "I'm not—" He stopped, started again, differently. "The equipment concern you raised. You were right to raise it." Emily kept her eyes on her chart. "I know that too." A long pause. "You should have raised it directly with me," he said, and there was just enough edge left in it that she could tell he hadn't fully arrived anywhere yet. Hadn't fully made peace with the image of himself that the night had produced. Maybe he would. Maybe he wouldn't. That was his work to do. "I did raise it directly," she said. "You were on the phone." He opened his mouth and closed it. "Good night, Dr. Veld," she said. He walked away. She went back to her chart. Teat. At 6:15 a.m., Thorne found her in the break room. Emily was eating a granola bar that had been in her locker since Tuesday and tasted like cardboard and honey, and she was doing it standing up because she'd been on her feet for 15 hours, and sitting down felt like a commitment she couldn't make yet. Thorne sat at the table without ceremony. She had a coffee from somewhere. Real coffee, not the machine coffee, and she set it on the table and looked at it for a moment instead of at Emily. "The man who accessed the equipment corridor is talking," she said. "His name is Reeves. He's been doing contract work for a private intelligence firm that we've had a flag on for 2 years. The communications on Decker's device confirmed that the reroute of Voss's transport was coordinated between Decker and at least 2 other individuals, one of whom we believe is still inside this building." Emily put down the granola bar. "The man in the blazer." Thorne looked at her sharply again. It was becoming a pattern. "His name is Peter Galt," Thorne said. "He arrived at this facility 4 hours before Voss. He presented himself to Decker as a hospital compliance auditor. Our people tracked him to the parking structure at 11:30 p.m., and we lost him on camera at the service level." She paused. He hasn't been located. Emily thought about the footsteps she'd heard in the corridor outside the supply room, the shadow at the bend of the hallway. He was on the 4th floor, she said. Around midnight, I thought he was heading toward the equipment corridor, but the angle was wrong. He was going down, not up. Service level access is below the equipment corridor. She considered. Is there a secondary access point for the OR utility systems from the parking structure? Thorne was already pulling out her radio. Don't go anywhere, she told Emily. I've been on shift since 3 yesterday afternoon, Emily said. I'm not going anywhere. Thorne talked rapidly into the radio, short and precise, and one of her operators responded in the same cadence. She moved toward the door, then stopped. Dawson. She turned. Voss asked about you. When they were bringing him around in ICU, he wasn't fully conscious, but he said a name. She paused. He said Karis. Emily looked at the granola bar on the counter. He's going to want to talk to you, Thorne said, when he's stable enough. I know. Are you going to be ready for that? Emily thought about Karis Province, about a specific night and specific decisions and the specific weight of consequences she'd been carrying for 3 years, like something she'd agreed to carry and couldn't find a place to set down. She thought about a man recovering in an ICU bed who had last seen her in circumstances that neither of them had chosen. I'll be ready, she said. Thorne nodded. She pushed through the break room door. The corridor outside was quiet for about 4 seconds. Then a radio crackled, and Thorne's voice came through it tight and fast, and there were footsteps, running footsteps, not the measured tactical movement from earlier, but actual running, the kind that happens when something has changed faster than the plan accounted for. Emily was already at the door. Through the narrow window in the break room door, she could see the corridor, and she could see 2 of Thorne's operators moving fast toward the east stairwell, and she could see the stairwell door swinging shut on the tail of someone who'd just gone through it. Dark jacket. She pushed through the door into the corridor. One of the operators, not the young one from earlier, a different one, broad-shouldered, with a radio already at his ear, looked at her and said, "Stay here." "Which floor?" she said. "Stay? Which floor is he going to?" The operator hesitated for exactly 1 second, which was 1 second too long, because Emily had already looked at the stairwell indicator above the door, which showed the floor the door had last been triggered from. 6. The surgical floor. She thought about Voss in the ICU. She thought about a man named Peter Galt who had been in this building for hours, who had known it long enough to access the service level, who had lost the cameras once already, and who had been running, now, in the direction of a man he'd been paid to make sure didn't testify. The ICU was on 6. She took the stairs. She hit the 6th floor landing at a run and came through the stairwell door with her shoulder, not her hands, because her hands were already up and she was already scanning the corridor before the door had finished swinging. The ICU was to the left. 40 feet of linoleum and fluorescent light, a nurse's station at the midpoint, and beyond that the glass-walled rooms where the overnight patients were monitored by machines that beeped in the particular language of people who were still alive, but only just. The corridor looked empty. That was wrong. At this hour, there should have been at least one ICU nurse visible at the station. Greystone ran a 2-nurse overnight on the unit, sometimes 3 if census was high, and the station had direct sight lines to all 8 rooms. The monitors should have been visible from here, their screens showing the steady green lines of patients in managed sleep. The station was empty. The chair was pushed back at an angle that suggested someone had left it fast. Emily moved to the left. She stayed close to the wall. An old habit, something the army had installed in her so deeply it didn't require thought anymore. She moved in the flat-footed, heel-first way that produced almost no sound on hard floors, and she kept her eyes forward while her peripheral vision worked the doors she was passing. Linen closet, med room, crash cart alcove. The crash cart alcove. She stopped. The crash cart was partially pulled out from the wall. Not all the way, just enough that someone had accessed the top drawer and left it not quite closed. She looked at the drawer. Then she looked at what was missing from it. The laryngoscope handle was gone. Not the blades, just the handle. A heavy piece of equipment, 7 inches long, weighted at the base. Someone had taken it as a weapon of opportunity. Emily looked at the ICU entrance. Glass double doors, currently closed, the electronic lock showing green. Someone with a staff badge had gone through recently and not let them latch properly, because the right door was sitting 2 millimeters off the frame. She went through. Room 1. Empty, bed stripped, not currently occupied. Room 2. An elderly woman, asleep, monitor nominal. Room 3. A post-surgical patient, male, early 50s, asleep. Room 4. Raymond Voss. She could see him through the glass panel in the door. He was where he should be. Bed elevated 15 degrees, both lines running, the cardiac monitor showing the steady rhythm she'd last checked 40 minutes ago. His eyes were closed. Standing at the far side of his bed, between the window and the IV pole, was a man in a dark jacket. Peter Gault. He was holding the laryngoscope handle. He wasn't looking at Voss. He was looking at the IV line, the primary drip running into Voss's left arm, and in his other hand was something small and cylindrical that Emily recognized before she'd fully processed what she was seeing, because she'd seen field versions of it, smaller and cruder, in situations where someone needed a patient to stop being a patient. A syringe, already loaded. She had maybe 4 seconds before he pushed it. Emily pushed through the door. Gault spun. He was fast, faster than she'd expected, with the coiled readiness of someone trained for close environments. He came around the IV pole in one motion, and the laryngoscope handle came up, and she was already ducking under the arc of it, going low and inside his reach the way you do when someone bigger than you has a weapon, and the only safe place is too close for them to use it. The handle came down on her left shoulder instead of her head. It connected hard. She felt the impact all the way down her arm, a bright electrical shock of pain that told her the deltoid had taken the hit, and nothing was broken, but it was going to hurt for days. She drove her right elbow into his ribs on the way up. He grunted. He didn't go down. They were in a hospital ICU room, which meant the space was about as large as a generous walk-in closet, and there was a bed in the middle of it with a critically ill patient attached to it, and the IV pole was between them, and Gault still had the syringe. "Don't," Emily said. Her voice came out steady, which surprised her slightly. Gault looked at her with the specific assessment of someone deciding whether a problem is manageable. "You're the nurse," he said. "You were in the equipment room." "I was." "You should have stayed in the supply room." "People keep telling me that." He moved. Not toward her, toward the IV line, the syringe angling for the injection port, and Emily grabbed his wrist with both hands and wrenched sideways, using the torque of her whole body, and the syringe went one direction, and Gault's elbow went into the IV pole, and the pole went over, and the crash of it hitting the floor was enormous in the small, quiet room. Voss's eyes opened. Alarms started. The cardiac monitor hadn't been triggered. Voss's rhythm was spiking with adrenaline now, which was bad, but not immediately critical. But the IV pole hitting the floor had pulled the primary line partially loose, and the flow alarm was going, and somewhere down the corridor the nurse's station board was lighting up. Gault got a hand free and shoved. Emily went back against the window, the glass held, cold and solid at her back, and he was between her and the door now, and the syringe was on the floor near the bed, and Voss was awake and trying to sit up, which he absolutely could not do with a fresh surgical closure in his chest. "Don't move," Emily said to Voss, sharp and direct. Then to Gault. "You're done. There are federal agents in this building." "There were federal agents in this building," Gault said. He wasn't panicked. That was the most frightening part of him. The absence of panic, the calculating steadiness of a man running through contingencies. "Floor's been swept. Your people went to the parking structure." A small, cold smile. "I know how they think." "You don't know how I think," Emily said. She'd been buying time. She'd known it and he'd known it, and the question was what she was buying it for. Whether the alarm had reached anyone, whether the operators in the stairwell had come up instead of down, whether Thorne had redirected anyone to 6. Voss moved. Not sitting up. He was too controlled for that. Too experienced with physical limitation to do the thing his body was screaming at him to do. Instead, he reached sideways with his right hand, the hand without the IV line, and grabbed the call button that was clipped to the bed rail, and pressed it, and kept pressing it. The call system wasn't the alarm. It wasn't loud. but it went directly to the ICU nurses station, and it showed on the board in the corridor, and it triggered a secondary alert to the charge desk on the floor below. Galt heard it. His eyes went to Voss. In that half second his attention moved, Emily crossed the room. She didn't go for him directly. She went for the door, got it open, and then stood in the doorway, which put the opening at her back and put her between Galt and the only exit. "There's nowhere to go," she said. "The stairwells are covered. The elevator is being monitored. The parking structure is full of federal agents." She kept her voice even. The shoulder was throbbing badly now. "You came here to finish something that isn't going to get finished. Walk out of this room or get carried out of it. That's the only choice you still have." Galt looked at her, then at Voss, then at the syringe on the floor. Then the ICU doors at the end of the corridor opened and the broad-shouldered operator came through them at a run, radio up, and behind him was one of the federal agents from the third floor, and behind that was Thorne. Galt dropped the laryngoscope handle. It hit the floor with a sound like a period at the end of a very long sentence. The next 20 minutes were controlled chaos, the specific kind that happens when a critical patient's room has just been the site of a physical confrontation and 3 different agencies want to process the scene while the medical staff want everyone out of it immediately so they can assess the patient. Voss's IV line was reinserted by a nurse named Tomas, who arrived at a run, assessed the situation in about 3 seconds, and went wordlessly to work while federal agents stood in the doorway, being professionally useless. His cardiac monitor showed an elevated rate, expected, given that he'd just watched 2 people fight in his room. But his rhythm was holding and his pressure, when Tomas got a reading, was 104/68, better than it had been all night. Galt was walked out of the room in flex cuffs by the broad-shouldered operator, who had the expression of someone who would process his feelings about the last 20 minutes at a later time. Emily stood in the corridor outside room 4 with her back against the wall and her left shoulder telling her things she didn't want to hear. She moved her arm carefully. Full range of motion, painful but present. Not broken. She'd had broken before. This wasn't it. Thorne appeared at her side. "You were supposed to stay in the break room," Thorne said. "I heard running," Emily said. "You're not cleared for this kind of—" "He had a loaded syringe," Emily said. "He was 4 seconds from the IV line." She looked at Thorne directly. "What would his chances have been if I'd stayed in the break room?" Thorne said nothing. "I don't need to be cleared," Emily said. "I need to be useful. Those are different things." A long pause. Thorne looked at the room where Tomas was finishing the line reattachment, where Voss was awake and watching the doorway with the alert, calculating attention of a man whose instincts had kept him alive through things that would have broken most people. "Your shoulder," Thorne said. "It's fine." "It's not fine. Let someone look at it." "After," Emily said. "After what?" Emily looked down the corridor. The sun was beginning at the edges of the sky outside the window at the end of the hall. The particular gray-pink of Pacific Northwest dawn, thin and uncertain, the kind of light that looks like an apology for the night before. "He wants to talk to me," she said. "Voss, you said so yourself. He's post-surgical and just had an extreme stress event. He needs rest. He needs to know what happened in that room tonight. He's going to keep his own watch until someone tells him the situation is contained." She looked at Thorne. "You know that." Thorne looked at her for a long moment. 5 minutes, she said. "And you let the shoulder get looked at after." Emily pushed off the wall. What? The room was quieter, with just Tomas finishing his documentation in the corner and the monitors cycling through their steady readouts. Voss watched Emily come in the way that people watch when they're conserving energy. Eyes tracking, body still, nothing wasted. He looked older than she remembered, but then she probably did too. "Dawson," he said. His voice was rough with anesthesia and the particular sandpaper quality of someone who'd been sedated for hours and was still finding the edges of consciousness. "Sir?" "Don't," he said. "We're past that." She pulled the chair from the corner and sat down, which she did partly because she wanted to be at his level and partly because her legs were strongly suggesting that standing wasn't sustainable. "The man in this room," Voss said. "He's in custody?" "Yes." "And Decker?" "Yes." He closed his eyes briefly. Not sleep. Processing. When he opened them again, his focus was sharper. "How much do you know?" "Enough," she said. "Thorne briefed me on the operational outline. I don't need the classified layer. The classified layer is what nearly got me killed tonight." He shifted against the pillow carefully in the specific way of someone managing pain with experience. "I've been carrying documentation for 3 weeks. Physical documentation, not digital because the networks aren't clean. It goes before the committee in 11 days, he paused. "There are people who need that not to happen." "I know." "They rerouted my transport to this hospital specifically Dawson, because someone knew that if they could control the facility and create a controlled environment where my death looked like a surgical complication." He stopped, took a breath. "There'd be no investigation, just a tragedy." Emily thought about the relay housing, the retracted contact pin, the careful, deliberate work of making something look like a failure instead of a murder. "They were thorough," she said. "They're always thorough." He looked at her. "Why are you here? At this hospital? Nights?" The question was direct in the way his questions always had been. Not unkind, but without the social cushioning that most people used to make directness more palatable. She'd respected that about him in Karis Province. She still did. "I needed somewhere to land," she said, "after my discharge. After Karis." After Karis. He was quiet for a moment. Outside the room, the corridor sounds continued. Footsteps, radio traffic, the distant elevator chime, the ordinary machinery of a hospital at dawn. "I read the after-action on that operation," Voss said. "The full report. Not the version that went into the public file." He held her gaze. "What happened to your unit wasn't a failure of decision-making. It was a failure of intelligence. The information your team was given was wrong, and the people who gave it knew it was wrong." Emily's hands were in her lap. She looked at them. "I know," she said. "Do you?" She thought about 3 years, about 14 months of night shifts and supply rooms and the particular choice she'd made to stay invisible, because visible felt like a target, and she'd been tired of being a target. "I'm working on it," she said. He almost smiled. It didn't quite make it, but the intent was there. "The 7 men who came out of that field," he said. "2 of them work for me now. One's been asking about you for a year." She looked up. "After tonight," Voss said, and his voice carried the weight of someone who still had work to do and intended to do it, "there are going to be people who want to say thank you. I'm telling you now so you can decide how to receive it." He paused. "Don't disappear again." Emily opened her mouth. She didn't say anything. Tomas cleared his throat quietly from the corner. "Mr. Voss needs to rest." She stood up. Her shoulder protested sharply. She'd forgotten about it for a few minutes, which was the specific mercy of conversations that mattered. "Dawson," Voss said as she reached the door. She turned. "The documentation I mentioned." His eyes were closing, exhaustion winning, finally, over adrenaline and willpower. "I wasn't traveling alone. There's a secondary copy. My support officer was carrying it separately in case the primary transport was compromised." Emily waited. "She was routed to a different facility," Voss said. "Meridian General. 30 miles north." His words were slowing, sleep pulling at the edges of them. "She should have arrived 6 hours ago." "Okay," Emily said. "She hasn't checked in." The room was very quiet. "Her name is Sergeant First Class Dana Reyes," Voss said. 34. She's good. If she hasn't checked in, it's because she can't." His eyes were closed now, but his voice still carried. Someone knew about the secondary copy. Emily stood at the door for a long moment. Then she stepped out into the corridor and walked directly to where Thorne was standing with her radio and her coffee and the expression of someone who had not slept and was not planning to. "Meridian General," Emily said. Thorne looked at her sharply. The specific look. The 3rd time now. "Voss's support officer, secondary documentation carrier. She was routed to Meridian and hasn't checked in." Emily kept her voice level. "You think someone knew about the secondary copy?" The coffee cup lowered. "Meridian's 30 miles out," Thorne said quietly. She was already keying her radio. "I know. If someone knew about Reyes..." Thorne stopped. She pressed the radio call. "Alpha 2, this is Thorne. I need a status check on Meridian General Medical Center. Patient transport routed from the Black Ridge Corridor. Arrival window was between midnight and 0200. Name is Reyes, Dana, civilian cover. If she's in that system, find her. She released the call button, waited, static, then, copy major, stand by. The standby lasted 47 seconds. Emily counted them without meaning to. Major Thorne. The voice on the radio was careful in the way that voices get when the information is bad. Meridian General has no record of a patient transport from the Black Ridge Corridor in that window. They received 2 trauma admissions overnight. Neither matches the description. Thorne's jaw set. We have footage from the I-9 corridor cam at 0045, the voice continued. A transport vehicle with Black Ridge medical markings stopped for approximately 14 minutes at the rest area near mile marker 31. After that, the vehicle is not on camera again. Mile marker 31. Emily knew that stretch of I-9. She'd driven it a dozen times in the 14 months since she'd been in Black Ridge. The rest area at 31 was one of those half-maintained stops with a parking lot that backed up to the tree line. The kind of place that showed up in missing persons cases because it was exactly far enough from everything to be nowhere. Get air support to that location, Thorne said, already moving. Air support is 22 minutes out, Major. We have ground units closer. 9 minutes. 9 minutes, Thorne repeated. She looked at Emily. There was something in her expression that was calculating and reluctant in equal measure. You said you needed to be useful. Yes. I have 2 operators and a vehicle. 9 minutes of ground time before my units arrive at that location, and whatever happened at mile marker 31 may still be happening. She held Emily's gaze. You have trauma experience in the field. Extensive. Your shoulder is functional. Thorne looked at her for one more second. Then she turned toward the stairwell and raised her voice just enough to carry to the broad-shouldered operator at the end of the corridor. Calloway, vehicle, now. The highway was empty at this hour, the kind of empty that only exists in the window between 4 and 6 a.m. when the night's business is done and the morning's hasn't started, and the road becomes something impersonal and vast and slightly unreal. Emily sat in the back of the SUV with a tactical medical kit between her feet and her shoulder strapped. One of the operators had done it without being asked, working efficiently with the materials in the kit while the vehicle moved, and she'd let him because the strap helped, and pride was a luxury she'd left in the break room. The operator's name was Calloway. The other one was younger, Reyes, she thought, or something close to it, and then she registered that name differently now and pushed the thought aside. Thorne was in the front seat on the radio, managing the 9-minute countdown in real time. The sky outside was fully pink now, the trees at the highway margin black against it, and the mile markers came past in the headlights. 35, 34, 33. Emily checked the medical kit inventory by feel. Tourniquet, 2. Pressure dressings. Chest seals, both occlusive and vented. IV kit. Hemostatic gauze. A small airway kit. Someone had put it together with care and experience, which meant it had been put together by someone who expected to use it. What are we expecting? She said. Calloway glanced back. Unknown. Best case? Vehicle breakdown. Reyes sheltering in place. Communications dead. Worst case? He didn't answer immediately, which was an answer. Does she carry? Emily asked. Yes. Good. Mile marker 32. The road curved slightly to the left, and Emily could see the rest area exit coming up. A green sign with a picnic table symbol, the paint faded, the reflectors working. Thorne put down the radio. Ground units are 7 minutes out. Air is still 20. She turned her head slightly. Whatever we find, the priority is Reyes. The documentation is secondary. Understood, Emily said. The SUV turned off the highway. The rest area parking lot was small, 6 or 7 spaces, a covered picnic structure, restrooms in a concrete block building. The tree line started about 30 feet from the last parking space and went back into darkness. There was a vehicle in the far space, white-paneled van, Black Ridge medical markings on the side. One of the rear doors was open, no one visible. Calloway brought the SUV to a stop at the lot entrance, headlights on the white van. He and the younger operator were out before the vehicle had fully stopped, moving in the controlled spread that created coverage without clustering. Thorne came out the passenger side. Emily came out the back with the medical kit. "Van's been here a while," the younger operator said, low. "Engine's cold." Calloway moved to the open rear door. He looked inside and his posture changed in the small, specific way that posture changes when you see something you were hoping not to see. "We have a casualty," he said. "Female." Emily was already moving. The van's rear compartment had been fitted as a basic patient transport, fold-down stretcher, basic monitoring equipment, the kind of setup that looked like a legitimate medical vehicle unless you knew what you were looking at. The monitoring equipment was tipped over, the stretcher was pushed sideways, and on the floor of the compartment, wedged between the stretcher base and the wheel well, was a woman in her mid-30s in civilian clothing, dark pants, gray jacket, one boot missing, with a pressure dressing applied to her left side and her eyes open. Barely open, but open. "Reyes," Emily said, climbing into the compartment. She put 2 fingers to the woman's throat. Pulse. Fast. Thready. The pulse of significant blood loss and a body compensating hard. "I've got you. I'm a trauma medic. Don't move." Dana Reyes' lips moved. No sound came out. "Don't talk," Emily said. She was already cutting the jacket at the side seam to get at the pressure dressing. "Not if you can hear me." A small nod. The eyes tracked Emily with the focused attention of someone fighting unconsciousness 1 second at a time. Emily pulled the dressing. The wound beneath it was a penetrating injury. Right lower quadrant, entrance wound, the bleeding controlled but not stopped, the dressing having bought time that was nearly up. She reached for the hemostatic gauze. "What do you need?" Calloway said, from outside the van. "IV access and a pressure bag, if there's one in the vehicle kit. She's hypovolemic. I need volume." Emily worked without looking up. "And I need to know if there are other people in this area." "Working on it." Dana Reyes moved, a small, deliberate motion, her right hand reaching for her jacket pocket, the jacket Emily had just cut. "Hey," Emily said, "stay still." Reyes's hand didn't stop. She got to the pocket. Her fingers found something inside it, a small, flat object, the size and shape of a USB drive, but heavier, with a different casing. She pulled it out and held it up. Emily looked at it. Then she looked at Reyes's face. "The documentation," she said. Reyes closed her fingers around the drive. Then she opened her hand and held it out to Emily. A clear, deliberate transfer, not a collapse, not an accident, a choice. "I need you to hold on," Emily said, taking the drive with one hand and pressing the hemostatic gauze with the other. "Ground units are 6 minutes out. Air is 15. You've done your job. Now you let me do mine." Reyes's eyes held, her fingers closed around Emily's wrist, just for a second. Not gripping, just resting. A brief human contact in the floor of a tilted van at the edge of a highway in the early dawn light. Then her eyes closed. "No," Emily said, flat and hard. "Stay with me." The fingers on her wrist slipped. The monitor, still somehow running on battery power in the tilted transport unit, showed the rhythm. It was there. Weak and fast and irregular, but there. Emily pressed the gauze harder and reached for the IV kit, and outside the van she could hear Calloway running back with the pressure bag, and somewhere on the highway behind them a siren was starting, and the sky was light enough now that she could see the tree line clearly, and there was no one in it, no movement, nothing but the trees and the dawn, and the impossible arithmetic of keeping someone alive with what you had in front of you, when what you had in front of you was almost enough, but not quite. She'd been here before. She knew how to do this. She was packing the wound cavity with hemostatic gauze, the pack going in firm and deliberate, when Calloway got into the van with the pressure bag, and she registered him setting up the IV line in her peripheral vision, and she registered the siren getting closer, and she registered the drive in her left breast pocket where she'd put it, and then she registered something else, a sound. Under the siren, smaller, closer, a footstep, on gravel, from the direction of the concrete restroom building. Calloway heard it too. His head came up. The door of the restroom building was opening slowly, and it was not opening from the inside. It was opening from a push, a controlled push. And what came through the gap was not a person, but the barrel of a weapon. And then behind the weapon was a man she'd never seen before, and he was looking directly at her, and he was not looking at Calloway. He was looking at her left breast pocket. He was looking at her left breast pocket. Emily did not move her hands. This was the thing about training that nobody explained to civilians, that the hardest part wasn't the physical response, wasn't the fight or the run or the decision. The hardest part was the stillness, keeping your hands exactly where they were, your breathing exactly where it was, your eyes steady and your body quiet, while every nerve you had was screaming at you to do something. She'd learned stillness in Caris Province, in the specific school of situations where moving wrong got people killed. She kept her hands on Dana Reyes' abdomen, and she looked at the man in the restroom doorway, and she did not move. He was mid-40s, compact, with the kind of unremarkable face that was probably professionally useful. He was holding a compact semi-automatic with the flat grip of someone trained rather than practiced, a distinction that mattered. Trained meant he'd think before he fired. Practiced meant he already had. Calloway was 3 feet to her left, partially behind the van's rear doors, and the angle meant the man couldn't cover both of them cleanly. He knew this. She could see him know it in the way his eyes moved. Her, Calloway. Her pocket, Calloway. "The drive," the man said. "Set it on the floor of the van and step out." Nobody moved. "I'm not going to ask twice." "You should think about your next 30 seconds, Calloway said. His voice was completely calm, the specific calm of someone whose job had required him to be calm in situations considerably worse than a rest area parking lot at dawn. "There are federal units 2 minutes out and air support behind that. You fire that weapon and you are done." "Then I'd better be quick," the man said. Emily's right hand was still pressing the hemostatic pack. Her left hand was free. She looked at the man's eyes and tracked where they were. They went to Calloway, assessing the threat, and in that half-second she reached into her breast pocket. Not for the drive. She pulled out the drive and she set it on the van floor, visible, exactly where he'd asked. The man's eyes came back to her. They dropped to the drive on the floor. "Slide it toward me." Emily slid it, not toward him, not toward the door, but 3 inches to the left so it stopped against the metal frame of the overturned stretcher, just far enough that he'd have to come to it. She watched him do the calculation. She watched him decide. He took 2 steps toward the van. Calloway came around the rear door. What happened in the next 4 seconds was not elegant. It was not the kind of thing that photographs well or gets described accurately afterward, because everyone who was in it was moving and there was no clean perspective. Calloway got a handle on the weapon and torqued it upward, and it discharged once into the roof of the van, a sound like a thunderclap in a small room, enormous and immediate. And Emily went flat over Reyes to cover her, which sent a bolt of pain through her strapped shoulder, bad enough to make her vision white for a moment. And outside the van, the younger operator was there, and then it was over. The man was on the ground. The drive was still against the stretcher frame. Emily pushed herself upright, one-handed, and checked Reyes first. Pulse, still there, still threading along. And then she picked up the drive from where it had stopped and put it back in her pocket. The sirens were very close now. Calloway was breathing hard. There was a cut above his left eye from where the weapon's sight had caught him during the struggle. He touched it with the back of his hand, looked at the blood, and said nothing. "You need that looked at," Emily said. "After," he said, using her word from earlier, and the slight edge of dark humor in it was the first fully human thing she'd heard from him all night. The first police unit came through the rest area entrance 40 seconds later. The next 2 hours were depositions, which were their own particular kind of exhaustion. Emily sat in the back of a federal vehicle, a different one than Thorne's SUV, broader, with bench seating and a fold-down table, and gave her account to a man named Agent Desmond Farr, who was thorough and careful, and who wrote everything down in a small notebook with a mechanical pencil, which she found unexpectedly reassuring. People who wrote things down by hand were, in her experience, people who understood that details mattered and that the record was its own form of protection. She told him about the footsteps in the 4th-floor corridor, the equipment room, the relay housing, the conversation with Thorne, OR2, the ICU, Galt, the rest area. She told him about the drive in her breast pocket, which she handed to him in a sealed evidence bag, and which he handled with the specific, careful attention of someone who understood exactly what it represented. She did not tell him about Karis Province because he didn't ask, and because it wasn't relevant to his report, and because she wasn't ready. Reyes had been airlifted from the rest area at 6:47 a.m. The paramedics who loaded her, two of them, experienced, efficient, had looked at Emily's field work, and one of them had said, without particular fanfare, "Good packing," which was the paramedic equivalent of a standing ovation, and Emily had accepted it accordingly. Reyes was in surgery at Blackridge Regional by the time Emily finished her deposition. Her vitals on transport had been weak but stable. The paramedic had said she had a real chance, by which he meant a better chance than she'd had an hour ago, which was the only kind of chance that meant anything. The man from the restroom, the one Calloway had disarmed, turned out to be named Holt. No first name offered. He'd been in federal custody since 7:04 a.m. and had said nothing beyond his name, which was, Farr told Emily, roughly what they'd expected from someone at his level of involvement. He was the third person in custody overnight. The fourth, if you counted the man named Reeves from the equipment corridor, who had been talking since approximately 3 a.m. and had produced, in his fear, a volume of information that was, according to Thorne, more than we expected and probably more than he intended. Reeves was the thread that unraveled it. Emily learned this in pieces, from Thorne, from Farr, from the occasional radio conversation she was close enough to overhear, over the course of that long morning. Reeves had been the operational contact, the man who coordinated the equipment sabotage and the transport reroute, and the presence of Galt and Holt at the respective locations. He'd done it for money, significant money, paid through 3 layers of shell accounts that federal financial investigators had been tracing for 4 months. He'd known approximately half of what he was part of. He knew the target, he knew the method, he knew the timeline. What he knew that he hadn't expected to be asked about was the name at the top. Not Decker. Decker was local, operational, a man who'd been on a payroll for over a year as a reliable point of access. Useful. Not significant. The name at the top was a man named Warren Hale. Emily heard this name first from Thorne, in the parking lot of the rest area while the sky finished completing its transition from dawn to full morning, the light coming in flat and yellow off the wet asphalt. Thorne said it with the particular weight of someone who had been working toward a name for a long time. "Haley," Emily said. "Deputy Director of Operational Security for a private intelligence contracting firm called Meridian Strategic Partners, which is a name that will mean nothing to you." "It doesn't. It shouldn't. They've been good at staying out of the light." Thorne looked at the highway. "Meridian Strategic has held federal defense contracts for 8 years. The committee that Voss is scheduled to testify before has been investigating irregularities in those contracts. Specifically, evidence that Meridian has been selling operational intelligence to third parties." She paused. "Third parties that operate against U.S. interests." Emily took that in. "Voss was the investigating officer who assembled the evidence," Thorne continued. "The documentation Reyes was carrying is the chain of custody for that evidence. Without it, the committee case is significantly weakened." She looked at Emily. "With it, Warren Hale is looking at charges that will end his career and likely his freedom." "Where is Hale now?" "That," Thorne said, "is what we're working on." By 9 a.m., Emily was back at Greystone. She hadn't intended to go back immediately. Thorne had offered her a vehicle and a hotel room and a strong suggestion that she sleep. But there were things unresolved at the hospital that she couldn't leave unresolved, and she was running on the specific fuel of someone who has passed through the stage of exhaustion that makes you sleepy and entered the stage that makes you precise and slightly detached, like the world has been turned down a few degrees in temperature. The hospital looked different in the morning. It always did. The day shift arriving with coffee cups and the particular energy of people who'd slept, the overnight staff doing handoffs with the slightly hollow eyes of people who hadn't. The parking lot was full of vehicles it hadn't had at midnight, including 2 unmarked federal sedans that were about as unmarked as anything driven by people who all weigh 200 pounds and wear the same jacket. She went to the ICU first. Voss was asleep. Actual sleep. The deep, slow-breathing sleep of someone who had finally run out of adrenaline. His monitor showed a good rhythm. His color was better. She stood at the window for 30 seconds and then kept moving. She went to the third floor. The administrator's office had police tape across the door, which was new, and the glass panel beside it showed the room had been gone over. Drawers open, the desk surface cleared, the chair turned sideways. Standard evidence processing. The man in the blazer was gone and the office was just an office now, stripped of whatever it had been for the last 14 months while Wallace Decker sat in it and made decisions that Emily was only beginning to understand the full shape of. She stood in the corridor outside the taped door and looked at the glass panel and thought about 14 months, about how many times she'd walked past this floor, about the supply room on 4, which she'd been sent to like a child being sent to her room, and how that had put her in the corridor at the right moment to hear the footsteps. There was something almost funny about it. Almost. Dr. Veld found her there. He came out of the elevator with 2 other physicians she didn't recognize, outside consultants by the look of them, the kind of people who arrived after significant events to assess and document. And he almost walked past her before he registered that she was standing in his corridor looking at the evidence tape on his administrator's door. He stopped. The 2 consultants kept walking. Veld looked at the door, then at Emily. He had the expression of a man who had spent the last several hours having his understanding of the previous night reorganized against his will, and who was still somewhere in the middle of that process. "The relay," he said. Not a question this time, just a statement placed between them. "Yes." "Maintenance filed their report at 7 a.m. The federal investigators have it." He put his hands in his coat pockets. "The sign-off on Thursday was falsified. The technician who filed it has been identified." He paused. "He worked for Decker." Emily said nothing. "The ICU," Veld said. "Galt, what happened in there?" "Is on record with federal investigators. You can request a summary through the appropriate—" "I'm not asking officially," he said. The edge that had always lived in his voice was gone. Not softened exactly, but absent. The way a splint is absent once the thing it was holding in place has healed or broken completely. "I'm asking because I sent you to a supply room." He paused. "And while you were not in the supply room, you appear to have prevented 3 separate attempts to kill a patient in my hospital." Emily looked at him. "I should have listened to you," he said, "about the relay. Last night and before last night." He said it like someone reading from a document they'd prepared, careful and deliberate, and she understood that this was not easy for him, and that the difficulty of it was his problem to manage, not hers. "I treated you as a function, not as a colleague." "Yes," she said. "You did." He absorbed that without flinching, which she gave him credit for. "The board is convening at noon," he said. "There will be a review of last night's events and of the administrative decisions leading to them. Your personnel file will be part of that review." He paused again. "I'll be making a statement." "That's your choice to make," Emily said. He nodded once, formally, like an agreement had been reached, and walked down the corridor after his consultants. Emily watched him go. Then she went to find coffee, because she'd been awake for 22 hours, and the precise, detached clarity she was running on had a limit she could feel approaching. The break room on 6 was empty except for Patrice, who was sitting at the small table with a cup of tea and a look of someone who had been through a great deal and was being quiet about it. She looked up when Emily came in. "Sit down," Patrice said. Emily sat. Patrice pushed a second mug across the table. It was already poured, already the right color, which meant Patrice had been expecting her, which meant Patrice had been watching for her, which was the kind of small, precise kindness that Emily had been the recipient of her entire adult life from women who were better at expressing care than she was at receiving it. "How's your shoulder?" Patrice said. "Strapped? Functional?" "That's not what I asked." Emily drank the coffee. It was too hot, and she drank it anyway. "Thorne's people looked at it," she said. "No fracture. Deep bruising, possible minor tear in the posterior deltoid. I'll know more when the swelling—" "Emily," Patrice's voice was quiet and firm. "How are you?" The break room was very still. Outside the window, the morning was fully established, gray-bright, the Blackridge skyline low against a sky that couldn't decide between cloud and clear. She could see the corner of the parking structure where Thorne's vehicles had been last night, now empty. "Tired," Emily said. "I'm tired." It was the most honest thing she'd said in several hours. Patrice nodded. She didn't say anything else because she understood that there was a significant difference between tired from one night and tired from something considerably longer, and that Emily was experiencing both simultaneously and didn't need the distinction pointed out. They sat for a few minutes without speaking, which was its own kind of conversation. At 10:15, Emily's phone buzzed. A message from Thorne, 3 words. Call me, now. She stepped into the corridor. Thorne picked up on the first ring. Warren Hale, Thorne said without preamble. He boarded a private flight out of Blackridge Executive Airport at 6:50 a.m., 40 minutes before we had his name. Emily leaned against the corridor wall. He's in the air, Thorne continued. Flight plan filed to a private airstrip in northern Montana. We have FAA holding the destination, and we have a federal intercept team there, but the window... She stopped. He had someone inside. In the federal notification chain. He knew we were coming before we knew we were looking for him. Who? We're identifying them now. It's... A pause, the kind that meant something was being decided about how much to say. It's someone senior, someone with access to the overnight briefing chain. Emily thought about that, about the specific patience of a conspiracy that had been running for 4 months, that had layers inside layers, that had put a man in a blazer in an administrator's office, and a corrupted relay in a surgical suite, and a syringe in a man's jacket, and a gunman in a rest area bathroom. That kind of architecture didn't come from one person. The documentation, Emily said. The drive. In federal custody, chain of evidence is clean. You transferred it directly to Farr, and he logged it at 7:23 a.m. Hale can't touch it. Thorne's voice was tight but certain. But without Hale in custody, his lawyers are going to fight the chain. They're going to challenge every element of last night. They're going to say this was a rogue operation, unauthorized, that Decker was acting independently. A pause. They need Hale. So get him. The intercept team is in position, but his flight is squawking a medical emergency. The pilot has declared an in-air emergency and is requesting diversion to a civilian hospital. Thorne said it with the flat precision of someone describing something they found both unsurprising and contemptible. If he lands at a civilian medical facility, his lawyers will have a protection argument that could delay federal detention for... Which hospital? Emily said. A silence. Thorne. Which hospital is the diversion requesting? The flight plan alteration came in 11 minutes ago, Thorne said. Her voice had changed just slightly, just enough. The requested diversion hospital is Greystone Medical Center. Emily stood in the 6th-floor corridor of Greystone Medical Center with her strapped shoulder and her 22 hours and her cold coffee, and she looked at the window at the end of the hall. The sky to the north was clear enough that she could see the distant line where the plateau met the air. He's coming back here, she said. His lawyers are probably already calling the hospital administrator, Thorne said, except the administrator is in federal custody. Who's acting administrator? As of this morning, the board appointed an interim. A pause. Dr. Marcus Veld. Emily closed her eyes for exactly 2 seconds, then she opened them. How long until the flight lands? She said. 31 minutes, Thorne said. Emily, I'll be here, she said. She ended the call. She stood in the corridor and thought about Warren Hale, a man she'd never met, who had never once thought about her, who had set in motion a chain of events that had brought military vehicles to a hospital parking lot and a syringe to an ICU room and a gunman to a rest area bathroom, and who was now, with the specific audacity of someone who had operated without consequences for long enough to believe in his own immunity, flying back to the one location where everyone who had dismantled his operation was still standing. She thought about what he was expecting to find here. She thought about what he was going to find instead. And then, because 31 minutes was not much time and Marcus Veld was going to need a conversation he didn't know he was about to have, Emily Dawson walked back into the break room, finished her coffee in 4 swallows, and went to find the man who was, as of this morning, running her hospital. Veld was in the former administrator's office, not sitting at the desk. He'd moved the chair to the side of the room, as if he didn't want to occupy that particular position yet, or possibly ever. He was standing at the window with a file folder in one hand and the look of a man who'd been handed a building he didn't entirely want and was now responsible for everything wrong with it. The evidence tape had been moved to allow authorized personnel access. The desk surface was still bare where the investigators had cleared it. He turned when Emily came in. She closed the door behind her. "Warren Hale is on a flight that has declared a medical emergency," she said. "The diversion request is for this hospital. He'll be on the ground in 28 minutes. Veld stared at her. The file folder dropped to his side. "His lawyers will contact the acting administrator to arrange a protected admission," she continued. "That's you. As of this morning. They're going to ask for a private room, limited staff access, and almost certainly an argument that federal detention would constitute a medical risk." She paused. "They've done this before. It's a delay tactic." "This man," Veld stopped, reorganized. "He's responsible for what happened last night. He authorized it, yes. And he's flying back here. He thinks the hospital is a controlled environment," Emily said. "He had Decker. He had Galt. He had eyes inside the federal notification chain that told him we were looking for him before we knew his name." She met Veld's eyes directly. "He doesn't know what this building looks like right now. He knows what it looked like at midnight." Veld looked at the bare desk, then at the window, then at Emily. "What do you need from me?" he said. It was the right question, asked without qualification or caveat. The version of Marcus Veld who would have stood in this doorway 6 hours ago would have led with his authority and gotten to the question last, if at all. Something had shifted in the long machinery of him overnight, grinding into a new position under the weight of what he'd been forced to see. Emily pulled out her phone and read Thorne's last message. "Federal units will be at the hospital entrance in 15 minutes. They need the receiving staff in the trauma bay to be regular personnel. No obvious federal presence. Nothing that signals to Hale that the environment has changed. He'd recognize agents. He'd recognize anything that looks like a reception. He needs to believe he's arriving at a hospital, not a trap." She pocketed the phone. "But I need you to accept the admission. When his lawyers call, you take it. You give them the room they ask for. You tell them the hospital is cooperating fully with their client's medical needs." Veld was quiet for a moment. "And then? And then Thorne's people and federal agents do what they've been authorized to do, and Warren Hale gets arrested in a hospital bed, which is the most appropriate place I can think of for a man who tried to use a hospital as a murder weapon." A long silence. "All right," Veld said. His voice was even. Not enthusiastic, not reluctant, just decided. His phone rang 40 seconds later. Emily watched him take the call. She couldn't hear the other end. She'd moved to the doorway to give him space, but she could read it in the way he held himself, in the careful, measured responses he gave. Yes, they could accommodate. Yes, privacy protocols would be observed. Yes, the trauma bay would be prepared. He hung up. 20 minutes, he said. "I know," Emily said. She was already in the corridor. The trauma bay preparation took 11 minutes and looked, from the outside, exactly like a normal receiving setup for a medical emergency patient. Rolling crash cart in position, 2 nurses prepped, the attending physician on call running through the intake checklist. What it did not look like from the outside was the 4 federal agents who were currently positioned in the supply corridor behind the trauma bay, the 2 operators from Thorne's unit on the stairwell above, and Thorne herself in the nursing supervisor's station with a direct sight line to the bay entrance and her radio running constant traffic. Emily was not in the trauma bay. She was in the ICU. Not by Thorne's direction. Thorne had placed her in the nursing supervisor's station and then gotten a radio call and gotten distracted for 90 seconds. And 90 seconds was enough time for Emily to make a decision. She had reasons. The reasons were that Raymond Voss was in this building, awake and aware, and entitled to know what was about to happen 30 feet below him, and that nobody else had thought to tell him, and that the specific experience of being a target in a location without situational awareness was something she understood deeply enough that she couldn't leave him in it. She was in his room for 4 minutes. She told him about Hale. She told him about the flight and the diversion and Veld's phone call. She told him it was being handled. Voss listened with his eyes open and his hands flat on the bed, and when she finished, he was quiet for a moment, and then he said, "He still thinks he can buy time." "He's been buying time for 8 years, Emily said. "He's good at it." Not this time. Voss looked at the window. The documentation Reyes was carrying. It's secure? Logged at 7:23. Chain of evidence is clean. He nodded. Something settled in his face. Not relief exactly, but the specific quality of someone who has been holding a weight for long enough that its absence is almost disorienting. How is she? In surgery at Regional. She was alive when they airlifted her. The field work bought her time. Emily paused. She's tough. She is, Voss said. He looked at Emily with the direct, unguarded attention of someone who didn't have the energy left for anything else. You know this ends with you having to answer some questions you've been avoiding. I know. The committee. The after action from Karis. Your name is in the documentation, Dawson, not as a subject, but as a reference. What you did in that field is part of the record of why this investigation matters. He held her gaze. People are going to know. She'd known this was coming since the moment she'd seen the recognition on his face through the OR window. She'd had hours to sit with it, and she still hadn't arrived at a clean feeling about it, only the understanding that clean feelings were rarely on offer, and you moved forward without them, or you didn't move forward at all. I know, she said again. He reached out and put his hand over hers for exactly 1 second, a brief, solid pressure, the kind of gesture that doesn't need language and doesn't benefit from it. Go do your job, he said. She went. Warren Hale arrived by ambulance from the executive airport at 10:51 a.m. He was 60 years old, silver-haired, with the patrician bearing of a man who'd spent his entire adult life in rooms where he was the most powerful person present. He was lying on a gurney, but he was not lying down in the way of sick people. He was reclining in the way of people who've decided that horizontal is temporarily strategic, and his eyes were moving when the gurney came through the trauma bay doors, cataloging the room with the quick professional inventory of someone whose entire career had been built on knowing the layout before anyone else. He had 2 lawyers with him, which was not something that typically came through a trauma bay, but which nobody had prevented because nobody had been authorized to prevent it, and they were both already talking, one into a phone, one to Veld, who had materialized at the trauma bay entrance with the exact expression of a man doing something he had decided to do and was going to do without flinching. The attending physician, a woman named Dr. Lara Fitch, who had been briefed on the situation at 10:35 and had received the information with the calm efficiency of someone who had worked enough night shifts to have stopped being surprised by what the world produced, moved to Hale's gurney and began the intake assessment with complete professional composure. Mr. Hale, I'm Dr. Fitch. Can you tell me what symptoms you've been experiencing? Chest tightness, Hale said. His voice was smooth, practiced. My physician will want to run an EKG and get a full panel, Fitch said, in the tone of someone who had heard a great many descriptions of symptoms and was interested in the data. Can you rate the discomfort on a scale of 1 to 10? Hale's eyes moved past her, around the room. He was looking for something. Emily knew what he was looking for. The shape of a threat, anything that didn't fit the pattern of a routine trauma bay. The 2 nurses, the crash cart, the attending, the lawyers flanking him, doing their job. He didn't see what was wrong. He didn't see it because what was wrong was behind the supply corridor doors and in the stairwell above and in the nursing supervisor's station. And it didn't look wrong because the people doing it were very good at looking like nothing. 3, Hale said. Maybe 4. All right, Fitch said. We'll get you comfortable and start the workup. The gurney moved deeper into the bay. The supply corridor doors opened. There were 4 of them, and they came in the unhurried way of people who don't need to rush because the exits are already covered. 2 federal agents in the dark blazers that had apparently become the uniform of this particular crisis. 1 agent Emily recognized from the 3rd floor last night, the slightly unremarkable one, and a woman Emily hadn't seen before, seemed early 50s, in a charcoal suit with a federal shield on her belt, and the expression of someone who had been working toward this moment for a very long time. She walked directly to the gurney. Warren Hale, she said. I'm Special Agent Director Marlowe, Federal Organized Crime and Corruption Task Force. You are under arrest. She began the formal recitation, rights, charges, the procedural language that is its own kind of curtain coming down. And Hale's face went through a sequence of expressions in about 2 seconds. Surprise, calculation, decision. He's a medical patient, one of the lawyers said, already stepping forward. He cannot be. He's being transferred to a federal medical facility, Marlowe said, without looking at the lawyer, where his cardiac symptoms will receive full attention. Now she looked at the lawyer. Unless you'd like to assert that this particular patient requires care that the federal system is unable to provide, in which case I'd encourage you to file that motion at 26 Federal Plaza, where my office is, and where someone will get to it. The lawyer closed his mouth. Hale had gone very still on the gurney. He was looking at the room with new eyes now, seeing it the way he should have seen it when he came in, reading the layout for what it actually was. His eyes found Emily. She was standing at the edge of the bay. She hadn't meant to be visible. She'd come down from the ICU and taken a position near the door, out of the way, more witness than participant. But Hale found her the way that people find the thing they least expected. And he looked at her with the particular attention of a man assembling a sequence of events backward. Night nurse, equipment room, ICU, rest area. She watched him put it together. She didn't say anything. There was nothing she needed to say. The room was already saying everything. The agents, the shield, the lawyers who'd been outmaneuvered before they opened their briefcases, and the fact that Warren Hale was lying on a gurney in a hospital he'd tried to use as a murder weapon and was now under arrest in it. He looked at her for a long moment. Then he looked at the ceiling. "I want my attorneys," he said, to the ceiling. "They're right here," Marlowe said pleasantly. "They can ride with you." The board convened at noon, as scheduled, in the fourth-floor conference room that normally hosted quarterly budget reviews and department head meetings. Emily was asked to attend, which she did in the same scrub she'd been wearing for going on 24 hours, because she hadn't had time to change and had decided not to care about it. There were 7 board members, 3 of whom appeared to have arrived in a significant hurry from somewhere else, and 2 legal representatives for the hospital's liability insurance, and Veld, who sat at the head of the table in the chair that would have been Decker's, and looked like someone who understood the weight of the chair. The legal representative from the federal task force, not Marlowe, a different one, younger, with a tablet instead of a notebook, gave a summary of the previous night's events that was accurate, thorough, and carefully organized. He outlined the evidence regarding Decker's involvement with Meridian Strategic Partners. He outlined the documented sabotage of the OR2 backup relay and the falsified maintenance record. He outlined Galt's attempted access to Voss's IV line, the events at the rest area, and the arrest of Warren Hale. He also outlined, in the same flat documentary voice, the complaint filed against Emily in October, the formal write-up for insubordination in September, and the equipment concern she had raised in October that had been dismissed without follow-up, which was the equipment concern that, when it was subsequently raised on the night of the 14th of November, had revealed the sabotage. He put the timeline on the screen. Nobody spoke for a moment after the summary ended. Then one of the board members, a woman in her 60s, gray-haired with reading glasses on a chain and the expression of someone who had been running nonprofit medical boards long enough to have seen most varieties of human failure, said, "The complaint against Nurse Dawson. What is the status?" "Withdrawn," the legal representative said, "as of this morning. The filing referenced conduct that subsequent investigation has shown to be appropriate, and the filing itself was made at the direction of Administrator Decker, who is currently in federal custody." The woman nodded slowly. She looked at Emily. "Nurse Dawson," she said, "I owe you an apology on behalf of this board. The complaint should have been reviewed at the board level when it was filed, and it wasn't, and I'm not going to offer you a complicated explanation for that, because the simple explanation is that we trusted the administrator and we shouldn't have trusted him uncritically, and a member of our staff was harmed by that failure." She paused. "I'm sorry." Emily looked at her. The apology was real. Not polished, not prepared, but real, in the slightly uncomfortable way of real apologies from people who are not practiced at making them. "Thank you," Emily said. It was not forgiveness. It was not absolution. It was just 2 words that acknowledged the apology had been received, which was all that was required right now. Veld spoke next. He had a prepared statement. She could tell because he was reading from notes, which was unlike him, and because he was reading slowly, which was also unlike him. He described Emily's conduct in the OR. He described the equipment concern she'd raised, that he had not adequately responded to. He described what he'd seen in her work and what it had prevented. He used the word colleague twice. The statement was accurate. It was also, she understood, genuinely difficult for him to give, and the difficulty made it more honest, not less. By 1:30 p.m., the board had voted to expunge every formal complaint from Emily's personnel file, to confirm her continuing employment, and to commission an independent review of all administrative decisions made under Decker's tenure for the past 3 years. They also, because boards move in their own particular rhythms, and this one was clearly experiencing a collective reckoning, voted to establish a new position, Director of Emergency Trauma Protocols and Training. The hospital needs someone who knows how emergency medicine works in extreme conditions, the gray-haired board member said. Someone who can build protocols that work when everything else is failing. She looked at Emily. We'd like you to consider it. Emily looked at the table for a moment, then at Veld, who was watching her with an expression she couldn't fully read, something between professional respect and the slight wariness of a man who has learned that underestimating this particular person has consequences. I'll consider it, she said. That's all we're asking, the board member said. But at 3 p.m., Dana Reyes came out of surgery. Emily got the text from Thorne while she was in the hospital cafeteria eating the first actual meal she'd had in 27 hours. A sandwich from the second-floor deli counter that was ordinary and slightly overpriced, and was the best thing she'd eaten in recent memory for the simple reason that she was hungry enough that quality was irrelevant. She read the message twice. Then she put the phone down and finished the sandwich. Reyes was in recovery, stable. The surgeon's notes said the field wound packing had been, in his words, textbook, which was the surgeon's equivalent of what the paramedic had said at the rest area, and Emily received it the same way, quietly, as a fact, filed, and moved on. At 4 p.m., Thorne came to the hospital. She found Emily in the break room on 6, which had become, over the course of the night and morning, a kind of command center by accident. The coffee machine, the table, the window with its view of the north sky. She came in and sat down and looked like someone who had been awake as long as Emily had and was refusing to acknowledge it. Reeves's testimony is being expanded, Thorne said. He identified 2 additional members of the federal notification chain that Hale was using. Both are being suspended pending investigation. She poured herself coffee from the machine without asking, which was the kind of familiarity that develops in the specific way of people who have spent a night surviving something together. The documentation from the drive is being processed by the committee council. Voss's testimony is being fast-tracked given last night's events. And Hale. Federal holding. His lawyers filed 2 motions this afternoon. Both were denied. A pause. He's not getting out of this one. She looked at Emily over the coffee cup. He's been operating for 8 years on the assumption that the right people could be bought and the wrong people could be removed. Last night, the wrong people didn't cooperate. Reyes didn't cooperate, Emily said. No, she took a bullet instead. Thorne's voice was flat, but there was something underneath it. She's one of mine. Has been for 3 years. She set the cup down. And you. Emily looked at the window. You weren't supposed to be here, Thorne said. By which I mean, you weren't on anyone's list. You weren't a variable they accounted for. They accounted for everything else. The administrator, the equipment, the transport route, the notification chain, and you were the thing they didn't account for because nobody knew you were here, she paused. Because you made yourself invisible. I needed to be invisible. I know. I read Karis. Thorne said it carefully, without the weight of someone who was trying to create a moment, just acknowledging a fact. You took yourself off the board because you needed somewhere to put everything down, and you chose nights at a short-staffed hospital in a mid-sized city because nobody looks for combat trauma specialists at 3 a.m. on the orthopedic floor. Emily didn't say anything. The thing is, Thorne said, invisible and gone are different things. You were still doing the work. Every supply cart you organized, every equipment flag you raised, every patient you quietly kept an eye on past the end of your assigned duties. She held Emily's gaze. You never stopped doing the work. You just stopped letting anyone see it. The break room was quiet. Outside, the hospital continued. Gurneys, elevator chimes, the PA system, the ordinary, undramatic machinery of a place that kept people alive. It had been doing this all night while everything else was happening, and it would keep doing it tonight and the night after. independent of crises and conspiracies and the things people had tried to make happen inside it. Emily thought about that, about the hospital as a living thing, indifferent to the ambitions of the people who moved through it, concerned only with the basic work of keeping the sick alive. She'd been part of that work for 14 months. She'd been part of it in a field in Caris province before that. She'd be part of it tomorrow. That was not a small thing. She had started to believe it was a small thing, somewhere in the long middle of the past 3 years. The army had ended badly. Not her performance in it, but the way it had ended. The injury and the discharge and the after-action that sat in a classified file, telling a story about a night that she replayed differently, depending on how much sleep she'd had. She'd come to Blackridge in the particular way that people come to places when what they need is somewhere that doesn't know them yet. She'd taken nights because nights were quiet. She'd made herself small because small felt safe. What she understood now, sitting in a break room with cold coffee and a strapped shoulder and 27 hours behind her, was that small had never actually been safe. It had just been invisible. And the thing about being invisible was that it didn't protect you. It just meant that when the moment came, nobody knew you were there. Nobody knew she was there last night. That had saved a man's life. But it had also meant she'd been fighting from a corner instead of from the center, and fighting from corners was exhausting in a way that fighting in the open, with your whole self forward and your history visible, never quite was. She was done with corners. The position the board offered, Emily said, Director of Emergency Trauma Protocols. I heard, Thorne said. I'm going to take it. She said it without drama, without the slight tentative quality that decisions made in exhaustion sometimes have. She said it like a fact that had already been true and was only now being spoken aloud. And the committee? Voss said my name is in the documentation. It is. I'll make a statement, whatever they need. She paused. Caris province doesn't end the way I thought it ended. The after-action is wrong because the intelligence was wrong, and Voss knows that, and the record should reflect it. She looked at Thorne. I'm done letting a bad record stand because fixing it is uncomfortable. Thorne nodded. There was something in her face that was not quite a smile, but was adjacent to it. The expression of someone who has been hoping for a specific outcome and is watching it arrive. There's one more thing, Thorne said. She reached into her jacket and produced a small, sealed envelope. Voss asked me to give you this. He said you'd know what it meant. Emily took the envelope. Inside was a single printed page, a summary, brief, formal, the bureaucratic language of military documentation, describing an action in Caris province on a night 3 years ago, the holding of a corridor, the treatment of 7 casualties under fire, the decision to remain in position when withdrawal had been ordered, because withdrawal would have meant leaving the casualties, and the operator who stayed had made a call. At the bottom, in handwritten ink over the official type, classification removed, record corrected. R. Voss. Emily looked at the page for a long time. The things you carry get heavy in proportion to how long you carry them without putting them down. She'd been carrying this for 3 years. Not the action itself, not the night itself, but the distorted official version of it, the record that said something different from what happened, the silence she'd maintained around it because the classified container had felt both like a burden and like the only thing holding certain parts of her together. She folded the page. She put it in her breast pocket. Different pocket than the drive. Same side. The sun was setting by the time Emily came out of Greystone's main entrance. She hadn't planned to stop. She'd planned to go to her car and drive to her apartment and sleep for 12 hours and deal with everything else tomorrow. But she stopped at the top of the entrance steps because the light was doing something unusual. The Pacific Northwest almost never produced a clean sunset. There was always too much cloud, too much marine layer. But tonight the sky had cleared in the west and the light was coming in low and orange across the Blackridge skyline, and it caught the glass face of the hospital and turned it briefly gold. She stood there. Patrice came out the door behind her, heading home from the end of her shift, and stopped when she saw Emily standing at the top of the steps looking at the sky. "You're still here," Patrice said. "I'm leaving." Patrice came and stood beside her. They stood in silence for a moment, looking at the city in its evening light. "The board offer," Patrice said. "I'm taking it." A beat. "Good," Patrice said. "Just that. The particular economy of someone who means more than they're saying and trusts that it will land. I'm going to need people I trust to help build the protocols, Emily said. People who actually know how this hospital runs, not from the administrative side. Patrice was quiet for a second. I work days now. I know. I've been on nights for 17 years. I could probably stand a change. I'll need a charge nurse who knows where everything is and who's lying to her. Patrice made a small sound that was somewhere between a laugh and a sigh. That's one way to describe the job. Below them, a car pulled out of the hospital parking lot. An ordinary Tuesday evening at Greystone Medical Center. The day shift going home, the evening shift arriving, the rhythm of the building continuing as it always did, indifferent and essential. Emily thought about Voss in the ICU and Reyes in recovery, and the 7 men in a field in Caris province, and the contact pin in the relay housing, and Donna Reyes pressing a drive into her hand with her eyes closing. She thought about the long patience required to do invisible work in a world that only recognizes the visible kind. About how most of the people who had kept this hospital running last night would never be named in a report. Nurses who worked doubles, techs who flagged equipment that nobody listened to, night staff who saw things that didn't fit and raised their hands knowing the hand would probably be pushed down. The recognition felt good. She wasn't going to pretend it didn't. Standing in the board meeting while her record was corrected, having Veld read from his notes in his careful, deliberate voice, holding the page that Voss had signed, those things mattered, and they were allowed to matter. But they weren't what the work was for. The work was for what had always been true at 3 a.m. in a hospital corridor, or 2 a.m. in a field in Caris province, that there was a person who needed something, and she could provide it, and every piece of training and experience and stubborn refusal to become smaller than she was had made that possible. That was the only math that consistently added up. She turned and went down the steps. She had a car in the lot and a 12-hour sleep waiting, and tomorrow, a new position to build from nothing in a hospital that was going to spend the next year figuring out who it was now that the people who'd been running it wrong were gone. That was real work. Unglamorous, structural, the kind of work that didn't have a soundtrack or a moment of triumph. Just the slow accumulation of systems that worked and protocols that held and staff who knew that when they raised their hand, someone would listen. She was going to be very good at it, not because the night had made her into something new. She hadn't been remade last night. She'd just been seen, finally, fully, with all the years that preceded the night shift scrubs and the cold coffee and the supply room. And the scene had matched what was already there. That was the thing about the quiet ones. The ones who'd been dismissed and overlooked and sent to sort inventory while the important decisions happened without them. They didn't become dangerous the moment someone finally looked. They had been dangerous all along. They had simply been waiting for the door to open. Emily Dawson crossed the parking lot in the last of the evening light, got in her car, and drove home.